And so I do want to introduce the amazing speakers we have tonight. So thank you for being there, like I said, and holding on with the technological issues. Um, so we have Wes Jordan Cohen, an LMSW, and he has been with Out Youth as an intern and then a lead clinician of transgender wellness in partnership with Kind Clinic. Wes is a recent graduate from Texas State University and starting his clinical supervision in pursuit of being a licensed clinical social worker. Wes knew he wanted to provide a safe place for trans folks by the age of 19 when he saw his friends struggling to find competent, accepting therapists. Wes started his own gender affirming journey 4 years ago after struggling with family acceptance, volunteering at Out Youth. Wes gave Wes the courage to start his journey, and he hasn't looked back since. Wes enjoys spending time with his new kitten Apple, as well as binge watching British television or listening to podcasts as he dabbles in crafts. Leatherwork, sewing, painting, woodwilling, that's a lot of stuff, and that's amazing. We have Elizabeth Lawrence. Hi. They are a non-binary, queer, polyamorous mother of 4 adult children. They graduated from the University of Texas at Austin with a Bachelor's of Arts and a Master's in Science and Social Work with a specialization in gerontology, and worked for 10 years providing clinical interventions focused on grief, loss, and chronic illness, both in hospice and dialysis settings. In June 2020, they started to work as a medical social worker for the Kind Clinic, providing short-term crisis counseling for survivors of sexual assault and people living with HIV. In their private time, they're an alternative sexuality educator who has taught relationship workshops around the country for LGBTQIA+, polyamory, and fetish conferences. And then we have Sarah Sloan. She has worked as a clinical social worker in agency settings focused on mental health and mental health access for LGBTQ clients since 2003. Sarah has a private practice providing psychotherapy, supervision, and consultation. She is licensed by the state of Texas as an LCSW and is a board-approved supervisor. She is also a member of the Texas chapter of NASW and is a co-chair of the Texas Jail Project. She loves all types of music and is a voracious reader. Well, thank you all for being here. I know we wanted to highlight the positive aspects in social work, but I do want to talk about some of the previous or the recent rulings because I was writing this panel and this came about and I was like, we have to discuss it at least a bit. So I wanted to know y'all's thoughts about it. What the implications of this ruling are, and I'm going to read a bit so for people who do not know what I'm talking about. Okay, so the Texas State Board of Social Work Examiners voted unanimously on Monday to change a section of its code of conduct that establishes when a social worker may refuse to serve someone. This code will no longer prohibit social workers from turning away clients on the basis of disability, sexual orientation, or gender identity. And so I just want to ask, like, what does that mean for LGBTQIA patients seeking care? What does that mean for social work ethics? I know that like goes against a lot of ethics of social work. So if any of y'all want to jump in, that'd be fantastic.
Can we curse? Is that cool? I mean, this is, no, I also teach at UT in the graduate program, social work program. And I do the F-bomb prayer every Wednesday before I speak to my class, because I mean, this is fucked up and it's so shocking. And the reason why it is so effed up is because you would think that the Texas Social Work Board of Examiners, which is now under a new behavioral health committee, maybe you all know the name, but it's in an attempt for them to get organized because it's been pretty disorganized in terms of licensure and paperwork, which is what they do. And so the board, I don't know if you all did, but I looked up, I mean, the majority are social workers. The majority are social workers, and they voted unanimously, which is, just shocking, to ensure that we can legally discriminate against people on gender identity, gender expression, and sexual orientation. And as you stated, it's against our principles, which are the inherent worth and dignity of all people, social justice, on and on and on, in terms of and so, I was thinking, this is not going to be very positive because I'm not having very positive feelings, but I think that it's, I mean, it's a week away from the election. And I think it's just a stand, not just, it's affecting human beings, but it is definitely a stand to say, look at me, I'm still, involved in attempting to harm people who I don't have an affinity with or for, is just my, my straight up feelings right now. But I'd love to hear what you all think. Yeah.
I have opinions. To look at it from a more pragmatic, direct impact to my work perspective, I've already had several interactions with clients that have been very reluctant at first and said, oh, your pronouns are they, them. Are you're not going to turn me away, are you? And I'm like, no, I'm not going to turn you away. Like, it's already impacting their willingness to seek help, to engage in counseling, to engage in, case management. This is, especially for the clients that I work with, this is life and death. Are they willing to call the clinic and say, I was assaulted and I need some preventive medication? Or are they not going to call because they're afraid that somebody is going to turn them away because they were, a man having sex with a man or whatever it is? I mean, it literally is life or death. I can't emphasize enough that it changes the interactions that we have on the daily with the patients that we're working with. And don't forget that they made it to where we can turn away disabled individuals as well. So, let's just take an entire other marginalized population and just make that also miserable and uncomfortable. That's awesome.
I agree with the sentiments that both Elizabeth and Sarah shared. I had professors at Texas State that were not accepting of like trans folks, and so it can and even discuss their own homophobia with the class. And so when we don't educate and expose even our professors so that we can make it better for the students, then they're going out and they're having these same ideologies. And when I was looking at the board, I did notice like where they were serving, and they seemed like pretty conservative places that they were serving. So this also affects their ideology of how they should, how they would think about queer folks and disabled folks, and saying that they already have policies in place that protect sexual identity and gender identity and disabled people. It's just not accurate, and it's not being protective at all. And I used to work with folks living with HIV, what was formerly AIDS Services of Austin, now is Vivint Health, and people didn't want to tell me things. They're so used to being judged. And I have clients now who I work specifically with trans folks, work with adults and also some youth. And they tell me about therapists telling them, oh, you'll be a real boy one day. So like these thoughts like infiltrate when people have services and they don't want services. And so we have to educate. And I think that's like the big component is the education, which I'm so glad y'all are here today.
Yeah, and Professor Sloan pointed out too that, in rural areas where there might be a couple of social workers working, it's very detrimental to have this put in place because they might not have access to the care they need or have to drive many, many hours to find someone who can help them. And that's just absolutely terrible. So I just wanted to discuss that because I think that's such an important thing to talk about right now. Hopefully something will happen to change that. I don't know. Do y'all know anything about if it can be changed or is it set in stone for now? What do you guys know?
Well, on Thursday, there is an open meeting, and I was able to, you can sign up to speak or send in written, a written speech, I guess. And that's what I had to do based on the timing. But I was also able to look through the packet of information. There are hundreds of letters in disagreement for this decision. They never gave the social workers an opportunity to comment on it. It was really under the radar. And so it was really heartening to see the letters of lots of allies and queer folks writing about and from all over the state. So I hope that we'll have some influence. I don't know what happens when the governor throws in and then throws in something at the last minute and they vote unanimously. But they are bringing it back up on the agenda this Thursday, right? Is that what you saw, Wes? Or
Yeah, that's what I heard. And also they didn't follow the procedures that they have in place. They have to give us time to respond.
right.
So yeah, it was very last minute. They didn't give us the time to respond, and they have to. So.
If any of you are interested in standing against this, you can also just go to the governor's website in the contact section and write a note letting them know. I don't know how effective those things are, but anything that lets people know, and especially allies are so important, and there is a way for social workers to stand against it through this meeting on Thursday.
Yeah, thank you for the information. I'll try to send out that email in the listserv because I think that's really important for everyone to have their say. Even if it gets heard or doesn't, I think that's extremely important. And my overall goal for this workshop was not to focus on the bad things, even though we really need to talk about this. But I wanted to highlight your accomplishments and also get people interested in social work, specifically working with the LGBTQIA community. So I wanted to ask, what sparked your interest in becoming a social worker and working with the LGBTQIA community specifically?
Who do you want to have go first?
Anyone, you can go.
So I started out, I was getting a degree in psychology. I was a Plan 2 honors student at UT, very serious about going into academic research. I wanted to do research into behavior modification, like basic research, like don't talk to me with people thing. And then my father became very ill, and I assisted him through the last 8 weeks of his life as he went through hospice. And I remember one day just pulling aside the hospice counselor, and I was like, how do I be you? I don't understand how you can do this, but it makes a huge difference. And so he explained to me what an LMSW was and what a social worker did. And I was like, yes, that sounds like a good plan. So after my father passed, I applied for getting a master's, and with the intention of specializing in gerontology and end of life. I've done that for the last decade. Through my personal journey, I have a son who's now 19 that is a trans man. When he was 11 and first started to express complications associated with his body not being the body he was supposed to be in, I was like, oh, well, I have no idea what any of this means. This is problematic. I should read some more and talk to some people. And so just being the parent of a young trans person who was going through the process and went to Out Youth and went to the prom there, and all of the support that he got through Out Youth, and trying to advocate to find him, medical care, gender affirming care, surgery. I managed to get him started on testosterone by the time he was 12. He had top surgery when he was 15. He's very short and he's aggravated with that, but he has a great beard and he's a very happy young man. So, but that really changed my perspective, because when you have something that you personally are trained to do, I'm a trained professional. I know how to advocate in the medical field, probably at a level that 99% of the whole US population can't do, because, hook 'em horns. I was trained, right? And I've been doing it for a long time. And it was still like, oh my gosh, so frustrating. It was everything I could do just to get my kids started on T. I mean, it was crazy. And I just started to really see this just lack of support. I mean, Out Youth is like an oasis in the middle of everything. It's the only place you can get support, and there's so many restrictions around it, and there's just like all these little babbies that are like trying to get help, and then their parents are terrible, and you're like, oh my God. So you know, when the opportunity came up to kind of shift focus and get away from working in gerontology and have the opportunity to really work with where my heart is, and obviously as a queer person and as a non-binary person, you know, this is really important work to me. Being able to blend what I learned and move it into something that I'm so passionate about. Like, they pay me to do this? Really? Every day? All right. Yeah, I'll take the paycheck because I got to pay the rent. But I literally would do this. If I won the lottery tomorrow, I would do the same thing, except I would buy more stuff for my clients. It'd be awesome. So that's why I'm here.
Well, that's a great story. Yeah, I also have, personal like experiences with this, so that's why I'm interested, and I want, other people to be educated and understand why this is so important. So thank you for that. If either Wes or Professor Sloan would like to speak, I would love that.
Yeah.
Okay. Sorry. Since transitioning, I am very aware of the space that I take. So I became interested, I didn't really think about social work because my only experience was CPS when I was a kid. And when I was getting my bachelor's degree in history, I took women's history, and we learned about Hull House, and we learned about the history of social work. And I was like, oh my goodness, like this is so much more than what I thought it was. And so I knew I thought about being a therapist for my friends. I went to Blinn Junior College my first 2 years of school. So I was up in College Station area. My friends were starting to transition, and there weren't that many folks up there. There were like 3 of us, but I wasn't out yet. I'm from a Southern Baptist Mormon blended family. I grew up Mormon, so I had a lot of internalized homophobia and transphobia. And so I just wasn't able to accept myself at that point. But I wanted to. And I saw my friends trying to find a therapist so that they could get letters so they could start hormones. And they had to jump through hoops. They couldn't find a supportive therapist. They had to settle for what they could get. And they had to do 2 years of living as the opposite gender and sex and being presented that way before they could get their hormones. So seeing people jump through those hoops and not having real support was one of the things of like, I want to do this. And so when I was 26, I finally applied for social work school at Texas, well, actually at USC. I went there for a little bit and then transferred to Texas State. I decided it was time to transition, and so I did, but I knew that I wanted to intern at Out Youth, so I started volunteering with them first. Because if you want to get internships, you have to volunteer or have some connection with somebody. So I started volunteering, and I saw all the kids just being who they were and having a lot of support. So I was like, all right, this is my time. So I started transitioning, and I was able to work at ASA, and through there, I was introduced to Waterloo counseling, and I interned with the other Sarah here at Waterloo counseling and was able to work with more LGBTQ folks. And I was like, all right, this is what I want to do. And I was lucky enough to get contacted from Sarah Kapasdashi at Out Youth saying, hey, Transgender Wellness is hiring a program lead. Do you want it? Do you want to apply? It's like, heck yes, I get to be paid to be who I am, because I can't go to the store without meeting another trans person or like a non-binary person or a queer person that wants to talk and get support. So like, this is my life, and it is important to have boundaries, like professional boundaries and personal boundaries. But I just get to be who I am, and that's just so wonderful. So yeah, that's why I do what I do.
Good. Yeah, thank you. Good. So I'm just looking and seeing, I think I'm older than everybody. That's okay. Right. Okay. But I've worked for nonprofits most of my life, mainly in affordable housing. I worked for Habitat for Humanity for a long time, and but I'd always gotten a lot of feedback and had done my own personal work with therapists about that I might be good at doing this at a micro level, one on one, and so I was encouraged to do some sort of counseling program and thought about it. And social work really fit. It fits with my values, and that's what was exciting to me is looking at the list of values. And at that point in my life, I was a little bit older. I get to do a profession where it fits with everything I believe. I get to actually, work with people and encourage their self-determination and encourage their authenticity and do it in a non-judgmental way and let people be who they are without my judgment. Excuse me. Of course, I'm starting to cough right this minute, but sometimes it makes me think, should I be saying what I'm saying? It's like I'm stopping myself. So I went to school later in life, but came out later in life too. And social work school is what caused me to come out. So I came out later, and some work we had done there through a diversity project. Um, where we were grouped in groups, and I just walked into the group, the LGBTQIA plus group, for the first time. Was very exciting. And so I personally had a rough coming out experience, and it's almost the longer you're straight, the harder it is for people to understand that you're not. So I found I even had a therapist one time tell me, I don't think you're a lesbian. And I was like, okay, so this will not be a topic of conversation, which is just bizarre to tell someone they don't think that someone is an orientation, so anyway, I so I also felt like I didn't go into social work to be a social worker who works with queer populations. And so at some level, I fell into it, but in the best sense of the word, because where I worked at the time didn't have that many queer therapists. So people wanted to meet with someone who was part of one of those intersectionalities. So it would be me a lot of times. I also worked at Waterloo for a few years after I graduated, back when Gail Goodman was the executive director, and lots of folks work there that are out in the community now. It was a lot of fun. And I served on the board also at Waterloo. And so Waterloo was an experience. And then I also worked at the UT Counseling and Mental Health Center. So I was the LGBTQIA plus programming expert, if you will. So I did a lot of programming, that was a lot of forward facing for the counseling center. And so, it was just, I just began working on issues related to LGBTQIA plus populations on campus, and as an advocate, but also as a group therapist, and just love the field of social work. I love being a social worker. I love working with people who, I love just whoever people are, come, that they bring that to me, and we're able to work to in conjunction with one another to get people to the place that they want to be. So I'll leave it at that.
Well, thank you. And all these stories are so inspiring because y'all didn't immediately go into social work. You had something come and make you realize that that was the place for you. And that's just amazing because, everyone has their own path. And some students now might not even realize it until later that this is what they want to do. So thank you for that. It makes things more normalized when people don't automatically have to jump to what they think they want to do in life right off the bat. So yeah, that's amazing. And I wanted to hear more about your experiences as a professional, and like, how would you encourage current students interested in social work, or how would you get people interested in social work? Or students in social work, do you have any tips or like positive stories to get them excited for being in this field? And Elizabeth, if you want to start again, that'd be amazing.
Like, boy, do I. I think that the best tip that I can give you as a student of social work, I remember, oh my gosh, they kept telling me, trust the process, trust the process. I swear, if I heard trust the process one more time, I was going to choke somebody out. I was like, stop it with your process. Makes no sense. And then you walk into class sometimes and you're in trouble because the chairs are circled up and you're like, oh, it's going to be that day. We got to talk about our feelings again. No. But honestly, you trust the process as you go through it. You're never going to understand exactly why you're learning what you're learning until you're sitting out in the field somewhere. And for example, I took an entire semester, it felt like, where all we did was model minimal positive responses. Professor Sloan, I'm sure you understand, like, just trust the process, minimal positive responses. And we would practice the therapeutic silence. And I'm like, this is the dumbest class this is a waste of, where's my research? I wanted science, right? So I'm just nodding until I was sitting at the bedside of a hospice patient the day before he ended up dying. And it's late at night. I'd been called out because it was kind of a crisis situation. I'm talking to this old dude. And as he's talking, he tells me this god awful thing that was completely unexpected about, an abuse that he had committed as a younger man. And I'm like, because what else are you going to say? Like, I was unprepared. I had no response. It was like the worst thing that anybody had ever told me they had done. And I realized in that moment, like, I'm here to bear witness. I'm here for him. There's no child being harmed right now. This is decades ago. Okay. Like, and I just sat there and man, I remember thinking in that moment, oh my God, I'm so glad I went through that process, because otherwise, how do you know what to do in such a weird moment in time where you're interacting with somebody at such a core level and you don't know what to say? It's not me that's got anything to say to that except to just listen. And you really do learn how to do that. So when you look at the potential of becoming a therapist and you think, oh, I could never do that. My friends talk to me, but I wouldn't know what to do if something terrible or whatever. Trust the process, man. It will get you through it. Somehow, someday you're going to be like, I'm so glad I sat through neurobiology. Wow, that was a really good plan. So that's my story.
Thank you. Wes or Professor Sloan, would you like to speak?
Okay. I totally related to what you were sharing with Elizabeth. I also work at a crisis hotline on the weekends, and it's a lot of, yeah. So sometimes, for me, like a tip is a lot of introspection, because when we're aware of where we're coming from, we can learn to how to better help our clients, and learning not to be judgmental, learning what our preconceived notions are, and not being afraid of feedback, and also to ask the hard questions and have the hard conversations. As a white provider, I know that when I walk in the room, and I have a person of color that I'm serving, that there's more than an imbalance of power of just me being the therapist. It's also, I'm white. So I have those hard conversations, and learning to have those hard conversations is super important. So that's a big tip that I have. And also, like, if you haven't gone to therapy yourself, I definitely recommend giving it a try. It was really surprising when I started school and we were asked in my class, has anybody gone to therapy? And to raise your hand. And I was the only one in a group of like 30 other students. And it was just shocking. And yeah, I definitely recommend like giving it a try. If you want to do it, I think that you should have some experience with the process. Process.
Yeah, I think with I think sometimes students in social work are like, this is easy, or it's not rigorous. And it's a science program. It's a, science and social work where I teach. And there are some more rigorous courses, research and a handful of courses depending on who you take and what they require of you. But I think the most rigorous part is getting to know yourself, because we teach from a professional use of self model. And so professional use of self is not just like self disclosure. Professional use of self is marrying the knowledge piece with you, who you are, and you're the vehicle toward bringing the science, the evidence-based practice, empirically based practice with your values, your beliefs, and bringing it and using it in service to the client and using all of it. Yeah, being out in the field and sitting with someone who tells you the worst thing they've ever done, and that they're not the worst thing they've ever done. They're probably seeking redemption in that moment, and yeah, and your job is to bear witness. But it's also good to know ahead of time that you're not so fond of people who hurt children, and that you need to balance out what that means so that you're not acting out when someone tells you that it's more complicated and we don't know. So, there's no excuse and no defense, but we don't know what this person's faced and what was going on at that time. So I think that's one thing I would say is really to know thyself in whatever way you can. I think one way, and I am certainly not, I wouldn't lay this down as a rule, but I do know that there are some social work schools who want you to have had therapy. And then I also know that it's also pretty helpful to have had some kind of work in between undergrad and grad. Although you can go directly, you can be a post BSW and get your master's in 5 years. That's fine. I've got 2 students doing that right now in my class. But I think, or my cohort rather, but I think it is helpful to work and to work in the field if you can. Yeah. And do you want to speak to that, Wes, or are you just agreeing? Yeah. I think I notice a difference when students have had work experience of some sort and because those first year internships require at UT Austin do require a bit of professionalism and high expectations. So having some type of experience with that is really helpful. And then also I want to push, I'm a clinical social worker, I'm a clinical supervisor, but I want to push the other side of social work that is administration and policy and also, I teach it the generalist practice in some clinical classes, but social work is a broad field and we're literally everywhere. And we are making a difference. And I was at an AIDS hospice for my internship. I was at, I've been in all sorts of spaces and also I appreciate politics and policy and advocacy, and we're called to do that as social workers. It's in our code of ethics. So even if I sit with people who pay me lots of money every hour and do clinical work, which some social workers do, we are called to advocacy and action and participation in the political process and so forth. So regardless of where you think you're going with your degree, the code of ethics doesn't delineate between clinical practice and that other side. It's the whole field. So those are the tips I would just say about the program, and I agree wholeheartedly with Wes and Elizabeth.
Did want to add a little bit to you should definitely have some work experience in between. I majored in history. not very useful if you don't want to be a teacher. So my dad got sober and went to rehab when I was 21. And I started really thinking about how substance use and abuse in my family affected me and affected my family. So I thought about becoming a substance abuse counselor. And you can do that with getting an associate's degree. But also you can go get your master's and become a licensed therapist, and then go back and get that added to your licensing. But I started working at a drug and alcohol rehab, when I like a few years after I got out of my undergrad, and I was trying to decide, do I want to be a substance abuse counselor? Do I want to be a social worker, or do I want to go and just do counseling? Do I want to be a lawyer? So I worked at the substance abuse facility for 3 years, and I was able to learn more about myself and heal myself, through like learning good boundaries, learning positive psychology, and like figuring out and talking to other providers like LPCs, and LCSWs, and talking to them about their process of like going to school, what it was like and what it was like after, and what they could do with their degree and their licensure. Because me, I was like heavily leaning towards becoming an LPC, and then I realized that social work, was more of what was close to my heart and what I wanted to do. So I think having that experience really led me to finding what was the good path for me. So I totally agree with having experience.
Thank you. Yeah, I totally resonate with that. I am currently a psychology major and realized it's not for me after experience working with many social workers. I was like, this is my place, this is my space. So really excited to pursue that. Hopefully get my master's soon. But I also wanted to ask you, for students who are less aware of the LGBTQIA plus population needs, like why do we need specific training for this, and what kind of problems do the gender and sexually diverse community face that might be different from or more heightened than other populations?
I've been going first. Do you want me to go? All right. Yeah. Okay. So whenever you are a marginalized group, you are at greater risk for negative health outcomes. Studies have shown, for example, transgender individuals are at devastating risk of physical assault, sexual assault, homelessness, joblessness, addiction, risk of all kinds of just really, really, I mean, it's like tenfold, 12 suicide. I mean, it's just, it's absolutely terrifying. I remember distinctly when I first realized, oh, I think my son might be transgender. Wow, I need to figure this out. And I started reading, and I was like, oh, I was devastated, because I realized that the chances of him just surviving to be 25, were just absolutely not on par with anybody else in his cohort. And so I began the process of really advocating for him and working with other parents through the years. You know, I frankly have just boiled it down to, you can either support him or you can bury him. Make your choice now. And the reality is, as practitioners, sometimes they don't have a supportive family. And if we aren't a truly safe space, they might not make it. And to me, less dramatic, but I'm not being over dramatic, trust me on this. But for example, my son, I've almost lost him twice because he had a urinary tract infection, running a fever, sick as a dog, never told me a word. I finally found him almost unconscious. Twice this happened because he was too embarrassed to go to see a doctor. He was too afraid of being misgendered, of having to have a gynecological exam, about having to even talk about that part of his body was so uncomfortable to his psyche, that his dysmorphia was so intense that he literally at 13 and 15 years old would rather lay there and burn up with fever than tell mom, I think something's wrong. What saved his life was that we found a place that is now called Pride Family Medicine, was called Zest. And when I first took him to Zest and he met the practitioner, the practitioner at the time was Francis, who's passed. And Francis said to him, "I'm a GP, I'm your gay practitioner. Don't worry, it's going to be fine." And just that made my son so at ease. I could see his shoulders relax, his jaw unclench. And literally to this day, if he's sick at all, he won't go to an emergency room. Like, he won't go to an urgent care. He won't go see anybody else because he doesn't feel safe enough. He would literally just rather die than go through the trauma of having to face that kind of misgendering, dysmorphia. I mean, it really is something that you can't know how profound it is until you see it. And once you see it, then you can be such a huge supporter. You can be so helpful. It's so easy to just use the right pronouns. It's so easy to say, well, what parts of your body do you have sex with? Instead of talking about their anatomy. Let them tell you what words do they use for their body. Like, just learning enough so that you can be a safe space makes all the difference.
Yeah, thank you for sharing that. I think also hearing people's stories with, the kind of things that were happening, especially, with your son, I think it's so important to hear the need for this kind of care and the need for this training. So thank you for that. Wes or Professor Sloan, do you have anything to add?
Well, that's very powerful. And I still, I was going to go in the direction of, I think we need additional training because of how, depending on what age you are, how you were taught or not taught. And so if you learn the world, the boys are blue, the girls are pink, and we've got we've got a binary, and this is how sex occurs, and this is how life occurs, and this is how courting occurs. Have at it. And I grew up in that where there wasn't another choice, and the person who choice, yeah, of course, there wasn't any, this was just the way it was. And so the people that were outside of that paradigm were teased, bullied, talked about, othered. And so you caught on very quickly to stay in the norms of the time, or so that was me in high school in the 80s. If you can imagine the 1980s, just think back a little bit, or maybe not think back. And so I think as I continue to work at the Counseling and Mental Health Center, students were coming in and they were checking, whatever boxes, who they loved, how they identified, how they expressed themselves. And there were no problems related. There was a lot of support. They were coming out earlier. They were, but I still think gender expression and identity is one of our last frontiers, where today I even looked up how much research is happening related to trans issues. And it's, compared to other issues, it's like 600, but if you saw the research in other areas, that's nothing. And part of it is because it is a smaller population. That's there's a number of reasons, but mainly it's still around safety and just safety, physical safety, emotional safety. And with stories like Elizabeth's son, but also mental health issues, people still waiting 3 or 4 or 5 sessions to tell me, anything about their sexual orientation, even though I couldn't use any more open language to discuss everything I ask about too. A funny story, Sarah, is that one time someone lied to me that they were bisexual because they thought they could only come to Waterloo if they were bisexual. And so finally they came out to me as straight. And I was like, It's okay. It's not your fault. You're straight and we understand. You can stay here. We see everyone. And so, but I thought that was funny. She was like, I've been living a lie. I'm not bisexual. And I was like, okay, we can get through this together. So I love the safety that Waterloo provided. And I love, I think I get off. My students are like, you digress. And they said, it's interesting, but you digress easily. And I was like, yes. So I'll leave it at that for now and see what Wes has to say, if anything.
Yeah, I have to speak to both of what y'all shared. I think with the research, it comes down to like classification as well.
Yes. Yeah.
Most of the time when somebody's doing research on men who have sex with men, they do not include trans men. I had a professor at Texas State who was doing research on men who had sex with men like living with HIV, and I straight up asked him, well, are you including trans men in that? And he was like, no. That was just it. No explanation, just no. So I was like, okay, so we get left out. But now, like, if you're a trans man and you're attracted to men, then you're like a gay man. So you are a man who has sex with men. And then when you look at trans women, the classification when working at AIDS Services of Austin, when you would look at the chart, it would say MSM. It wouldn't categorize them as a woman. So it really skews the research and the data that we have. So I think the classification is hard. And I definitely go to a gay provider for my medical care. I started with Todd Cannon, and I was told to go to him by my therapist because she had met him at HRC and knew that he would provide hormones and knew that he was gay. So I was like, all right. And he was a gynecologist. So I was like, okay, one-stop shop anytime I need something. So we do that. But there are other providers, and Transgender Wellness Program About Youth does have a list of providers that folks can look at. And they can also be asked to be added on, and we vet them. We ask them questions. And if we get negative feedback, then we mark somebody off our list. We're not going to continue letting people think that this is a safe provider if they're not. It's really easy to let people know if you're safe. Introducing yourself, saying, hi, my name is Wes, and I use he, him, his pronouns. What is your name and what are your pronouns? Super easy. It lets somebody know that you're aware enough. I work at Integral Care's Crisis Hotline. When I started, they would put you either, if they didn't know who you were, they would put you either as an adult male or adult female or adolescent female or adolescent female. And I said, how do you know? How do you know that someone is female or male? How do you even know that they identify that way? And they were like, we don't. And I was like, all right. And so they were like, well, how can we change it? I said, ask people their pronouns. Super simple. And also, like, that everybody isn't male or female. There are non-binary people. So like, why don't we change our profiles to say femme, masc, and NB for non-binary? And they were like, oh. And two of my training supervisor and my program supervisor both use, one uses Z, them pronouns, and one uses they, them pronouns. Didn't even occur to them that they could make this change. So it's like super easy to let people know that you're a safe place, and it's really important to speak up. When I was in school, I came out in the middle of my first semester at Texas State, and so people, at first I didn't tell people because I wasn't sure how people would respond. And then I started being more vocal about it, and people started asking me questions, and I'm a very open book now that I'm older and I've been to therapy and worked through some stuff. I'm okay with talking about things, but not everybody is an open book. And I was willing to educate not only my cohort, but also my professors. Our clients are the expert on themselves. So I'm okay with that. But not everybody is. So I think it's really important that we educate ourselves and recognize that people have boundaries on what they're going to share.
Thank you so much for that. And I also have a question for all of y'all. I know that, UT has implemented a new program like the LGBTQ studies certificate and minor, which I'm currently taking, and I know that there's a women and gender studies program in the master's program. So, but I know when you guys were going through school, or depending where you went to school, that wouldn't always be offered. So I wonder where you got the education on this. Did you seek out trainings? Did you have classes? How did you guys navigate this?
I sought out trainings and got trained and am a trainer, I was at UT, there's the gender and sexuality study, and I was an affiliate there and a trainer for, things like Trans 101, Ally 101. When you see the rainbow affirming placard on we were providing the training so that faculty and staff could receive those. And so when you teach or train, you learn. It's a good thing, because that's how you also get trained yourself. But I've sought out additional training as much as I can, just to keep up also with what's happening, where things are going. And I also work with polyamorous couples, and so wanting to have and just couples that are not considered non-traditional, and sometimes other therapists are like, I'm not, they can be judgmental, or I don't understand that because it's not me, so I don't, and so I don't like those responses at all. And I have, so I've taken it upon myself to, to understand sexuality and connection in a more broad way than, again, we're taught one way, and then, we have to undo, and that's around race, gender, sexuality, a myriad of issues. And so our undoing is good work, and it also it opens up opportunities. But I would highly recommend, we have CEUs that we attain, 15 hours a year. Is that still, and so I get them for teaching, and I get them for other things all the time. But when you teach, so I don't have to keep up with them as much as I used to, but I tend to seek out additional opportunities around couples work, sexuality, and so forth. So I don't know what you all do, Wes and Elizabeth.
For me, I only ever had one class on gender and sexuality, and that was in my undergrad, which I also went to Texas State, and Texas State is actually pretty conservative. My professor was amazing, but like listening to my other classmates, it was so hard. So I found like a lot of just supplemental education when I was assigned papers, research assignments in my master's program. I chose the topic, and I would choose topics that related to being queer and being trans. So I would always make sure that all of the research that I was doing was going to relate to the work that I was wanting to do, because they weren't teaching me it. And I just love research. It's like one of the reasons why I majored in history. I just love research. And luckily I work at Out Youth. So anytime I need some training, we have it. But also our organization does quite a bit of training in the community. So a lot of the time it's like in organization training. And my clinical supervisor was my supervisor that I had at my internship at Waterloo. Her name is also Sarah, and she has worked a lot with trans clients. So I have a clinical supervisor that I get to talk to that is knowledgeable about what I'm doing and the clients that I'm working with. But really, for me, it's just been supplemental education and interest, and being interested in like what affects me personally being a queer trans person.
So I would say all of that, as far as getting CEUs, seeking out things that are, around LGBT issues, all of that. In addition, the only thing I would add is that I also went to high school in the 80s. I didn't go back to college until I was 34. So you do the math, it's been a minute. I honestly was 34 before I figured out I wasn't straight, because everybody was straight. They told you that. Like, I didn't know what two women having sex was. And so I was having a conversation with somebody and they were like, no, blah, blah, blah. All the cool people are bi at least. And I was like, well, I'm straight and I'm cool. And they're like, you're not straight. You're with so-and-so. I'm like, oh, that doesn't count. We're just friends. They're like, oh, really? And I like literally sat there like dumbfounded, because I was raised in the 80s. We didn't have the internet. We didn't know, like, if you had a beeper, you were a doctor or a drug dealer. Like, we didn't have cell phones. There was no Google. So I'm like listening, like, what do you mean I'm with so-and-so? And they're like, well, you do, wait a second. And then he sat back and he was like, how do you think two women have sex? And I was like, oh my God, I'm so gay. Oh, wow. Oh, hang on. Like, oh, like, I was shocked. I was like, oh, I've been doing that for a long time. Wow. Oh my. And it really like rocked my whole world, because it was a perspective that I had never considered. I mean, I just didn't grow up where there was information available. And so once I realized, oh, I'm super not straight at all, then I began to explore on a personal level, like, what does that mean? And back in the 80s, we were taught that this was a terrible thing. And two women together were just trying to avoid having to be around men because they hated men, and like weird things that are in your head that you don't realize are there. That's called unconscious bias. And so by the time you start unpacking that, you're going to find ways to educate yourself. And the very best way to educate yourself is to surround yourself with people who are part of the communities that you're interested in. Most of the things I learned about how to be a queer person, I learned in a bar, at a fundraiser, or, hanging out at like a coffee shop with a whole bunch of queer people and just going like, oh, you guys are really queer. Let me ask you a question. And then eventually figuring out, oh, wait a second, I'm the one that's being really weird here. Hang on, let me just drink my coffee, right? And then the experience, of course, of raising a trans kid really shifted my focus. I mean, by the time I was 47 was when I started to realize, oh, I'm not at all a gender. I'm non-binary. I am not either male or female. It isn't a matter of feeling like, I know my son is trans. I get that. I have a daughter who's butch. I get that. I wasn't either of those things. And it's funny, my children have taught me a lot. My son still sends me text messages all the time about, well, maybe you're a demi-girl. I'm like, I'm not a demi-girl. I don't even, what is that? No, what are you talking about? He's like, no, you need to read this definition, Mom. I'm pretty sure that's what you are. I'm like, I don't think I am. He's like, are you sure? Read it again. I'm like, stop it. Just non-binary. He's like, are you sure? I'm like, gender fluid. And he's like, fine. Like, he really wants me to have some really like defined identity, which I think is hilarious. But you just surround yourself with people that are not like you. It's the same thing as dealing with being white and being able to take care of people of color, Black people. I spend a lot of time with my Black friends and family so that I don't walk around being a jerk, right? Like, that's the best way to understand a marginalized or a disenfranchised people. I spend a fair amount of time at this point with homeless people. Not a thing I sought out. I didn't expect that, but it turns out that a lot of my clients are homeless. And I'm like starting to feel the jam. I'm like, all right, yeah, you're right. The rain and cold. Okay, what are we going to do about that? Like, it changes your perspective. So yes, take CEUs. Yes, take classes. Yes, get an additional certificate. But spend your time where you want your energy to be. Surround yourself with people that are not like you so that you can figure out what that's like.
And I would say, to the very least, read about other people's experiences, or attempt to listen to other people's experiences, watch, good depictions of other people's experiences so that you understand. But yeah, the same on how to be.
Yeah, and I think a lot of like what I've learned from social work as an undergrad is reading a lot about lived experiences, but I think it's so much more impactful when you hear it from the person themselves, because you get that emotion and you get that understanding that you wouldn't have just reading something like literature. And I of course learned a lot from reading lived experiences, but I think at a personal level it's just so much more impactful to me. So I thank you for putting that in there, because that is an amazing way to learn from others. And I know, Wes, you mentioned research, and I know we briefly talked about research, but I know there's so many gaps in research and programming. I know Austin's okay about it, because we have so many amazing nonprofits and organizations in the area that do help, but I know in other areas and rural areas there are gaps. So I would love for you guys to speak on what gaps you've seen, and what research should be done in the future to help the LGBTQIA community prosper. So if any of the research nerds, Elizabeth or Wes, I'm also
Why am I a nerd? How did I get to be a
Nerd's
nerd,
a
right?
good thing. I am a research nerd.
The only thing I have a very short thing, because really research, I've been out of academia for a long time, so it's a little rusty. I don't know if I could do SPSS anymore. I think I'd have to take a tutorial, but I can say that, for example, I take Descovy, which is a PrEP medication, which is a pre-exposure prophylaxis. It is intended to keep me from, if I'm exposed to HIV, my body is less likely to seroconvert the virus, and I am protected from becoming positive with HIV. I am a female-bodied person, so taking Descovy, there's not any research at all to say that that's okay. There's no research on what that looks like in my body. There's no research on what that would look like if I were to try to carry a child to which I'm not doing that anytime soon. But the research on women and the prevention of HIV is disgustingly bad. A lot of that has to do with finances and biases of Western culture, because men who have sex with men tend to be the ones that Gilead and the different pharmaceutical companies market to for PrEP and medications for HIV. But if you look at the world HIV crisis, the epidemic, it is affecting female-bodied people at enormous rates, especially in the African continent. There are just women that are just, it's bad. And yet we're putting all of our money into researching the implications on a male body. Now, we could easily all see that happens across the board in medical research, that a lot more money is spent on men's bodies than female bodies. But specifically when it comes to LGBTQ plus communities, we need to do better. We need to study, what does it do if you're trans? What does it do if you're on T? What if you're on this? What are we doing? Why are we putting everybody on PrEP? Okay, but I was the first person that was identified female at birth that the clinician gave Descovy to at my particular clinic. And I was like, well, I work here, so I'm not going to get mad, right? Like, it's fine. But there needs to be better research. We need to look at how medications affect each of the different types of people that we take care of.
I totally agree. I literally, in my thing, it was about trans men being left out of MSM research, and trans women being grouped with men, and like race, how race and being queer like correlate. But yeah, they actually never told me that they didn't do any research. And I've like met with Gilead reps when I worked at AIDS Services of Austin. And at AIDS Services of Austin, like half of my clients were AFAB women, and AFAB means assigned female at birth, and AMAB means assigned male at birth. But there is just a disproportionate amount of folks who are women of color being diagnosed. Those are the new cases being diagnosed in Austin. And there's just not a lot of research. The research that we see is mostly geared towards white men who have sex with men. The cases that Gilead came and talked to us about when we were having our little lunch and learns, the folks that contracted HIV while being on PrEP were Hispanic males. So what's going on with that? We don't know. I also see a lack of research in substance abuse and that affecting trans folks, especially trans men. I have seen an increase of trans men struggling with addiction of meth, and they're not really getting help. The first trans man I ever met was when I worked at the substance abuse facility, and everyone was awful to him. Clinicians didn't know how to handle it. I wasn't out yet, and I made sure that I was the person that he dealt with because I was the person that had information that I knew, because I knew that I identified as a trans man, but I couldn't be out yet. So I had to explain to him that we had to like mark F on his paperwork because we were doing medical. They made me do a pregnancy test, like all of these things, because that was the medical classification. And so just like talking with him, and he came in for meth, and like they didn't know what to do with him. They didn't know how to treat him. They didn't know how to help him. And that was in 15, I guess. And they had just opened up a rehab, like I think in Boston, that was specifically for trans people. And so he got out of our facility as quick as he could. And I'm so glad that there are more facilities that are opening up that are specifically for trans people, because when trans people are trying to receive services, they're like, if they need to be housed because they're experiencing homelessness, if they go to a shelter, it used to be that Salvation Army would send trans women away. Well, now they're not. Now they will house trans women in the women's field, but you have like my clients would get approached by other clients staying there and be like yelled at and told that they needed to get out. So there needs to be like more education and protection. When I would house, so I worked in the housing department at AIDS Services of Boston. When I would be housing clients in boarding homes, if it was a trans woman, they would be like, no, we don't want her here because we don't want her in a room with an AFAB person. And it's like, she's not going to do anything. She's not a threat. And it was just really, really difficult to navigate these things, and to also have other providers, your coworkers, not respecting pronouns and names. Yeah. It's so simple. So simple. We call people Jack when their name is John. Like, how hard is it to call somebody by their name? And luckily at Out Youth, like, we don't really need to know someone's legal name. Sometimes I never know someone's legal name. I don't. They can put it on a piece, they can like fill it out in the paperwork, but I never see it. That's in our legal database. It's not for me to see. They can tell me their name if they want. But there's so many barriers to receiving services that Out Youth tries to break those down, and so does Kind Clinic. And so those are some things I see, lots of barriers for just all services.
I would say all the above, because I know you probably want to go to, I think there's a question, but UT, I've been working with, I'm on the provost and president's committees for LGBTQIA plus issues, and, you know, from names, pronouns, housing, all the above. But my main concern, and as I said, the last frontier, I hope last, is that I think social workers need to have more comfort around gender identity and gender expression and sexuality and sexual orientation, so that they can advocate for the services that we're talking about. The medical field is still behind the providers, and you've spoken eloquently on both, so I don't need to say any more, but that was where I was going to, so you said it.
Great, thank you. Hopefully this will inspire and bring, new ideas to future social worker and researchers' minds, I'm hoping. And we have a question from Yona. For anyone doing clinical work, what are you noticing right now regarding the needs of COVID? And for academic folks, how are you approaching the topic of COVID with your students?
I can speak to the sort of pragmatic in the field bit. Right now, with rare exception, we are not seeing our clients in person. If somebody has the inability to access technology to do telemedicine, if there's a safety issue around that for any reason, or if they're a new gender care client and needs to come in person, there's a couple of different categories where we will have them come in for an in-person visit, but most of our work right now is being done through telemedicine. So as a clinician, I've had to shift my ability to interact with a patient. Like, this is a whole learning curve. If you want to talk about some CEU learning, like figuring out how to be present with someone through Zoom has been a learning curve. And I think it's a learning curve for the clinicians that are doing the medical work, and for, those of us that are doing counseling. I mean, you lose a lot when you can't see the body language as well. I have found that it has given some access in ways that I think we wouldn't necessarily have had access. What I currently do is I work with people that are referred to us from SAFE that have within the last 24 or 48 hours have experienced a sexual assault. And I find that they do talk to me via video or phone, where I don't think that at that point in their trauma response, they would be cognizant enough to go drive to a counselor's office and sit down on a couch, right? So in some ways, I think there is benefits that we've seen because it is accessible in that immediate way. You can just talk to somebody, you can just get on the video with somebody. But yeah, and then what it's done to our homeless population is crazy, awful, like things you don't even think about, like the fact that the libraries have been closed, and that there's so many like coffee shops that are closed. They don't have Wi-Fi now, because they used to go and sit and buy one cup of coffee, and then they would have Wi-Fi all day, and they could look for jobs, or they could apply for their food stamps, or they would have access to things. Now all those things that they were using as resources, air conditioning inside the library, using the bathrooms at whatever restaurants, they don't have those things now. And so it's become really a lot harder to be homeless. And there's more people than ever that are becoming unhoused. I mean, and I don't know what to do with them. I don't know. There's just no more housing resources because there's just so many people that are out of work. Also, we have had, I think the last time we looked at it from last month, the month before to this, the month before that. So a 3-month trend, we are up 4-fold on our assault referrals. And I absolutely believe, without research, because I'm in the field, I don't have to prove it, right? But I really believe that it's because of COVID. People are just starting to get COVID crazy. And, especially women are putting themselves in situations and being in situations that they wouldn't necessarily have been in, because they're just kind of getting lonely, and they're just kind of getting stir crazy. And so all of a sudden, meeting somebody they just have talked to maybe on the phone a few times, well, you can't go meet at a restaurant or at a park necessarily. So, you end up making decisions that aren't necessarily the ones you would have made. And then I think that the perpetrators are taking advantage of that. So it just feels like there's more of everything bad and very little good. Yay.
I would say economic instability. And a lot of my clients who are trans identified do participate in sex work. That's and I've seen an increase in that. And also it's important to come from a non-judgmental point, and also be educated on how how to provide resources for having safer sex, like, and knowing what an internal condom is and how it is used and like where they can get them, because people need to survive during this time. And I definitely think like an increase in crime stuff happens when we're bored, or, when people don't have any other outlets and there's no place for us to go. Um, We've seen an increase in like food instability. So my clients kept on reporting instability. So I talked with my supervisor, Sarah Capostacci at Out Youth, and we opened up the queer and trans community closet. And so it's open to anybody that identifies as LGBTQIA, and also for families of youth who identify as LGBTQIA. And of course, we don't ask for proof. And we have a very simple form. It's what's your name, what's your phone number, so that we can get in contact with you and fill out this form telling us what you need. And we have a list of fresh produce that we had been financing, and now we're also getting some from Urban Roots. So we're utilizing our connections in the community. And Kind Clinic is a big help. Kind Clinic, it actually is the funder of the Transgender Wellness Program, and Francis's memorial from Pride Medicine also was a big funder for our community closet. We have canned food, so shelf-stable food. We get the fresh fruits and vegetables. We have binders for folks that need binders. Since we can't have them come in and like help them figure out what size, we tell them how they can figure out their size. We have hygiene products. We make sure that we have hygiene products for like menstruation. And when people need a specific item, we have a little box where they can fill that in, and we figure out how we can make that happen. We also provide like art kits so that they're not just sitting there, and so they have something to do. And especially like we tell people, like, if you have more than one person in your household, let us know so we can provide enough food or enough art supplies, whatever you need, so that everybody is getting the help. We also have HEB gift cards that we give out. It's limited to one person a month, and we have 31-day bus passes. We're just trying to make sure that people are getting the help that they need, and we do that with our community partnerships, because queer community comes together like nobody's business. We want to be collaborators, and we don't want to try to just own it all one organization. It's really about collaboration.
I'll speak so briefly. Thank you for the work you all do, by the way. For academic folks, how are you approaching the topic of COVID with your students? I was going to joke and say I scream at them and tell them to suck it up, but that is not true. I'm very, very interested in modeling what it means to be a social worker with my students because of the parallel process they go or with clients. And so I attempt to hold boundaries and encourage them to utilize self-care and boundaries. And then they can also help clients have boundaries and use self-care, and so on and so on. So one of my biggest jobs is to try to stay into a state of being and regulation so that I can be someone who, the School of Social Work, UT, did a lot of work on COVID because our students are in the field right now. So in the whole School of Social Work at UT, we're not in the building because the ventilation is one of the oldest buildings on campus, and the ventilation is not good for COVID. So we're all online, which is, Zoom teaching. Everything takes longer, harder. We're doing a hybrid model. I am. So what we do is we work with them to give them information, and then we want them to be safe too. We want them to be protected and also to have the ability to make decisions about it. So we're approaching it from a self-care and trying to talk about Zoom fatigue and COVID fatigue and pandemic fatigue and election stress. And, you know, is there anything, yeah, and anything else we might add? So, Wes, I wish you were my student, but I think I have a lot to learn from you. So there. Yeah, so that's, I'll leave it at that. That's how I've been approaching the topic and trying to understand how we're all being affected by it. It's new. Talk about research. We have no idea. We have no idea what it's about. So, and how it's all going to change us in some way, you know, 2020.
Yeah, for sure. And I wanted to leave this off with kind of a positive note, I guess, to see maybe hopefully in the future, if we rewatch this, then some of these things will have come true. So what are your future goals for LGBTQIA health and programming in Austin? I know we're almost running out of time, so we can speak sort of brief about it if you guys need to rush, but yeah, I would love to hear your thoughts about that.
I actually wrote something down, so I'm going to read it real fast. An ideal world would be people would be educated, not threatened, and honor the lives of all LGBTQIA plus peoples. We would do that. We would just honor, period.
I agree. I also wrote something, but I also want to just right now, like most of our spaces are really white centered, and making sure that it's more inclusive. And there is a new nonprofit, grassroots nonprofit that just started up. It's called Black Trans Leaders of Austin. It is with Naomi Wilson, and Rocky Lane is involved, and Tabitha. And I just forgot her last name, and I'm so sorry. But they are trans-identified folks of color. They're Black folks of BIPOC, and they want to make sure that our spaces aren't just white spaces. And BTLA isn't about just being a space for Black people. It's about being a space to come together, to work together, and build just break down racism, like dismantle systematic racism, and provide services to everyone, and make sure that people are competent in providing services for everyone. Yes, intersectionality.
For me, the ideal would be that there's no wait lists for assistance and help on any of these things, because, you know, 200 client wait list for Waterloo, you know, for 8 weeks wait to get into a gender care appointment, things like that. We simply have to do better, and we are doing better. I mean, the Kind Clinic has grown in the last 5 years to where it's just amazing. So I highly recommend that you look at the Kind Clinic, kindclinic.org. The services that we have there are amazing, and I think that we very much are innovative and moving towards a broader future. We are a program of Texas Health Action that recently is Waterloo Counseling is now a program of Texas Health Action. So in the next 5 years, we are going to see, hopefully, I think, the Texas Health Action umbrella with Kind Clinic and Waterloo moving into providing more and more counseling. So greater resources, I think, come out with greater health outcomes. So.
Awesome. Well, I thank you so much for being here. I love to hear your input, and I hope future students and future social workers can watch this and kind of learn from y'all. This is also being recorded, so if there's something you realized, oh, maybe I shouldn't have said, we can cut it after using our amazing skills. And so y'all feel free to reach out to me if you want me to cut something. And I just wanted to thank you so much for your input, and have a great night. And I hope to work with you guys in the future. Thank you so much.
I'm sticking with my profanity at the beginning. Don't worry about it. I want it on. All the way. That's the only way to describe it. So thank you all, everybody. It was nice to meet everybody.
Nice to see
I
everyone.
hope that our contact information will be given to the students so that, at least for me, if any of you wanted to contact me, if you ever wanted more information about the Kind Clinic or my experiences or any of that stuff, please feel free to use me as a resource. So please make sure that they have that.
Yeah, we can definitely add that to this. Yeah, thank you so much.
Yeah. Awesome.
Okay.
Thank you so much.
Thank you.
Bye, everyone.
Bye.